Hello, my name is Cameron Foy. In this presentation, I will be discussing the dangers of hazards in the field of nursing and the effects it has on nurses. To begin, according to the Health and Safety Authority, a hazard is a potential source of harm or adverse health effect on a person or persons. There are different types of hazards in the field of nursing. The classification of hazards ranges from biological to chemical to physical and to mental. Each classification ranges in severity of safety and health on both nurses and patients. The biggest contributor to the problem of nurses being uneducated on how to properly handle and respond to hazards is due to a lack of resources. There is little government law regulation and creation on the exposure to hazards and nurses' protection. Along with that being said, there is also little workplace facility regulation and protection to nurses. Nurses' personal safety and health are risked because of a lack of guidance from the government and workplace facility. With a lack of resources, workplace facilities are unable to properly contain and resolve hazards. This often results in hazard outbreaks with no adequate solution and increased call-out days from nurses and staff. As nurses and staff health continues to be compromised, turnover rates increase with little staff to treat patients. With this in mind, patients' quality of care is compromised, breaking the main goal of healthcare facilities. Ultimately, when nurses are not protected, patients cannot receive adequate care they were once promised. There are many sources that hazards can originate from. Radiation treatment, MRSA, bloodborne pathogens, needle sticks, and patient handling are common sources of hazards. Simply assisting a patient down the hallway, giving a patient a bath, or even handling patient medications can result in devastating hazards that can be the start to long-term health problems. There have been numerous solutions proposed and implemented to resolve the crisis, but all have failed. First, education sessions are held around the world and country in hospitals. Sessions are created by the workplace facilities on different topics. For example, Wilson Health held education sessions on OSHA, CPR, and bloodborne pathogens. The issue with this solution is that the workplace facilities often forget to take into the consideration of the nurse's hectic schedule. Limited sessions are held, and because of the nurses' hectic work schedules and a lack of educators, many a times nurses are not able to attend. Next, the North Carolina Nurses Association, NCNA, has opened conferences to the public for nurses to attend, listen, and provide feedback on. Once again, the NCNA has failed to take into that consideration of the nurse's schedule. With a lack of sessions availability, many times, nurses are not able to attend because of timing and location difficulties. Finally, there are little government-created hazard law regulations implemented with nurses in mind. The process for creating new laws is very slow and time-consuming. For example, needles have been present for centuries. It was only until 2 decades ago that the Needle Stick Safety and Prevention Act was created to regulate the use of needles and exposure of pathogens. This one law took years in the process to create and to be implemented. Even though all the solutions are great, they are not properly implemented with the right sources as of right now. The proposal to reduce hazards is through the creation and proper implementation of education sessions. Workplace facilities will regulate optional and mandatory sessions to nurses at numerous times. Mandatory sessions would be on hazards that most or all nurses come in contact with. For nurses to continue working at the workplace facilities, all must attend the mandatory sessions. Optional sessions would be on hazards that not all nurses come in contact with, but hazards of specialized departments, such as radiation. During the sessions, educators would discuss what the hazard is, the effects of the hazards, and ways to reduce the risk of exposure. Along with the creation of sessions, nurses would be highly encouraged to attend and advocate for law creation at North Carolina's Nurses Association board meetings. Through advocating, nurses would be able to express their feelings and thoughts, hopefully provoking a sense of urgency in the creation of the government law regulation. It is important to note that hazards will forever be present in the field of nursing, but by taking an initiative to changing the ways of healthcare, patient and nurses' safety would increase dramatically, impacting lives forever. The improvements on the field of nursing, workplace facility, and patient care would be phenomenal. Workplace facilities and nurses would be able to prepare properly to hazard outbreaks with the proper resources such as education and new machinery. Educated nurses in workplace facilities would allow for facilities to be aware of current flaws and ways of improvement. Along with education, nurses' safety and health would increase because of proper implementation of the resources. Nurses would encounter a lower exposure to hazards, increasing their ability to care for their patients. The proposal is very feasible. The cost of the proposal is calculated in the annual budget for the workplace facilities. Every year, hospitals and medical facilities have to budget money aside for each department, including education, for new resources, programs, and staff. The budget is then approved by the board members. The money approved by the board members will help assist in the creation of the education sessions, educators, and hazard resources. The most important improvement of the proposal will be the increase of safety for all personnel involved within the crisis. In conclusion, implementing proper resources will lower the risk of exposure to nurses and increase the effective care to patients. Mandatory and optional education sessions will educate nurses on the different types of hazards, the effects of hazards, and how to properly respond to hazards. Even though hazards will forever be present in the field of nursing, the time is now to change and lower the risk of exposures for all personnel involved. Nurses should not have to risk their health and their safety to be able to care for those who are suffering. Thank you for your time and your attention.